everyone, my name is Anastasia Dani William. I am a third-year psychology student from UNIMAS with a matrix number of 83215 and a study on the impact of Sarawak-Inspired digital Mandala art-based therapy on psychological well-being and calmness in Malaysian young adults. This study is about digital therapy tools to improve access for youth and Mandala art to promote mindfulness, calmness, and self-expression, which merges Mandala therapy with tech-boost engagement. Now for the problem statement, Raimi et al. States there is a need for culturally relevant mental health intervention, and Hassan et al. States that there needs to be a research on gender-specific differences in psychological well-being. And next, Troop et al. Mentions a need for future study to have a control group. Now, for this study's objective, it is to examine depression levels using PHQ-9 pre- and post-digital, and next is to determine anxiety levels using GAD-7 pre- and post-digital, and the third is to compare post-PHQ-9 digital versus control, and fourth to compare PHQ-9 change male versus female. And for the question is whether there is any difference using PHQ-9 before and after, and the second is the GAD-7 before and after, and for the third is PHQ-9 digital versus control, whether there is any differences. And for the fourth is PHQ-9, whether there is any gender differences. And for the hypothesis, for hypothesis 1 as well as 2, they were statistically significant. And for hypothesis 3 and 4, they were not significant. Now moving on to the theoretical framework, it is mainly centered around person-centered therapy, which was by Carl Rogers and later developed by his daughter, Natalia Rogers, into person-centered expressive art therapy, and can be explain more with biophilia hypothesis as well as flow theory and mindfulness. And next, for the conceptual framework, which is the independent variable, which are digital art-based therapy, which is experimental group, and control group is physical art-based therapy as well as gender. Then moving on to dependent variable is psychological well-being and calmness. Now next, moving on to the research methodology, this study uses mixed design quasi-experimental, and it uses purposive sampling, and it has a sample of 48 Sarawak-Indian young adults, which was conducted in Sarawak. And this sample size was determined using a statistical analysis of G power with a D effect of 0.8 and an alpha value of 0.5. Next is the research methodology. For the intervention and control, they were both had 24 digital and 24 physical, with both having equal numbers of female participants and male participants, both having 12 each. Both of them had 5-minute briefing, and then they had a pre-test of using G87 and PHQ-9, and digital had a 3-minute practice only, and then they had a 40-minute activity for both digital and physical, and then they had a 5-minute break before they answered the post-test using G87 as well as PHQ-9, and they have a 5-minute briefing. And next is the normality, whereby it was found to be non-normal, whereby it was not statistically significant with a 0.05 value, and we use a non-parametric test. For hypothesis 1 and 2, we use Wilcoxon sign rank test, and for hypothesis 3 and 4, I use Man-Yu Whitney test, and this is the ethics code. And next, the exciting part is the findings. So for hypothesis 1, it was found that digital interventions significantly reduce digital depression symptoms, and for hypothesis 2, digital interventions significantly improve calmness. And for hypothesis 3 and hypothesis 4, it was found to be, there was for hypothesis 3 no significant difference in psychological well-being between digital and physical intervention, and hypothesis 4, no significant gender differences. And this is the mean differences. For GAD-7, 5.88 dropped to 4, and for PHQ-9, 7.96 dropped to 5.03. Now for the discussion, for significance of Objective 1 as well as Objective 3 can be explained by person-centered expressive art therapy, whereby it explains that it facilitates emotional release and self-awareness through creative expression. And next, mindfulness and flow, where digital Sarawak-inspired mandala motif promoted immersive, calming states and a present moment focus. Next is cultural resonance, whereby Sarawak-inspired mandala motif made the activity more personal, meaningful, and it enhances engagement. And for the non-significance of Objective 3 and 4, whereby it explains that it could be a hybrid future where traditional and digital methods were equally effective. And next is equal engagement, whereby similar age, education, and digital access enable equal outcomes across groups and genders. Now in conclusion, digital art-based therapy is an effective intervention tool for improving psychological well-being as well as invoking feelings of calmness. Thank you.